Hello and welcome to our COVID chat. This is North Bay's way of reaching out to the community with important health information. We're talking all things COVID with Chief Medical Officer Seth Kaufman. Take it away, Dr. Kaufman.
Hey, thanks, Robin. Good morning, everyone. It's so nice and warm out there. I like the weather. We could use some rain, but I like the weather. As usual, I will start with a few hot topics. We don't have a lot this month, and then we'll go right into your questions. I'll give you a heads up. This will be our last session for now. We'll go on a little hiatus. We'll be watching COVID rates very closely, and then we'll start right up if we need to. So a few hot topics, and look down here in my notes. I think what's on everyone's mind is whether we're seeing new variants, and with that, do we expect a wave of infections to come? We are seeing that the BA2, or one of the sublineages of Omicron, is growing. It's called the stealth virus because some of the tests that are used to measure for it don't work as well, or it's a little different than that, but that's why it's called the stealth virus. We can still diagnose it. It just doesn't look like Omicron on some of the testing. And it is slowly growing. There's some pockets in the United States. This week, about 16% of the sequenced viruses that are being submitted is BA2, or the stealth Omicron virus. That's double what it was a week or two ago. It doesn't alarm most experts because there's a couple of things we know. We know that the chance of getting infected with this sublineage, if you've had Omicron or you've received the booster, is much lower. So most of the predictions, and they are just that, predictions, we really have a hard time knowing exactly what's going to happen. Most of the predictions feel that this variant will not cause a spike, but more maybe slow the decrease in cases, which we really haven't seen. We haven't seen it all, which we'll get into in a moment. So there are new variants all the time. This is one that's getting a biggest concern, is a little more transmissible. That's why it's growing and we're seeing more and more of it. But it's not thought that's going to cause a significant spike because it's close enough to the original Omicron, and if those who are boosted are likely protected, not 100%, and those who have had it, it's a lower chance of reinfection. There's just actually data out of Denmark showing there is a reinfection risk, but again, it's low. Boosters, kind of important. Talking about the variants, we don't have in Solano County less than half of those individuals who are eligible have not been boosted. That's a pretty important piece of data because the primary vaccine series, so for most people that's 2, for those that are immunocompromised can be 3 injections, isn't thought to be protective enough against Omicron or the BA2, the new kind of sublineage. So that's, really we should all be getting boosted. If you're eligible, go get boosted. If you're and that is 5 months after, for most, it is 5 months after the mRNA vaccine. So that's Moderna or Pfizer. It's 2 months after the Janssen, the J&J vaccine. There is a preference for those mRNA vaccines over Janssen, thought to be more protective. So if you haven't been boosted, go get boosted. This is the time to do it. We're hitting a low period right now. We don't know, but we can talk about whether there'll be another wave of infection. There probably will be, and we can talk about why. And so get yourself protected now. The last thing I'll say on hot topics is there was just a study that came out of the MMWR about 2 weeks ago. That's our morbidity and mortality weekly report out of CDC. Generally what comes out of there is very good studies. They're fairly large usually, very well done studies. This was looking at whether masking is effective, because there's still some controversy of whether wearing a mask, mitigates the risk of getting infected with COVID. And the answer is yes. So, and actually what's nice about that study is that they followed about 650 people who got COVID, and they looked at the masks they were wearing, and they had a control group who did not have COVID. They all looked exactly the same. It's a very good study. And they saw that as you went from surgical and cloth masks to N95, your protection against getting COVID increased. So the short answer is it reinforces what we already are seeing and what we know, but it's good to have scientific evidence behind it that masking works. Some quick data for you. Case rates in Solano County are about, the 7-day average is about 50 per day. So we're seeing about 50 cases in Solano County per day that are being diagnosed. Those are underreported, right? People do home tests and they turn positive. They don't report to anyone. They feel symptoms. They don't get tested. There's numbers all over the place, but it's thought that probably on any given day, whatever that number is, there's probably really 2 or 3 times that number, right? But it's hard to really confirm that. But Solano County 7-day average is about 50. During low periods in the past, so pre-Omicron, it was about 40. So we're almost back to the lowest period before the Omicron virus hit us in December. Positivity rates remain higher. It's one reason why we're still in the intermediate transmission risk as defined by the CDC. But we are, let's see, as of this week, we are at 7. So the positivity rate was 7. I don't quote positivity rates very often. It's kind of a mixed number, right? It very much depends on how many people get tested. And as rates drop, less and less people get tested, right? So it's kind of a complicated variable metric to follow. But on that note, at one point during the height of this wave of infection, we had like a positivity rate of 30, which meant of all those people, of everybody getting tested, standing in line at the mall, coming to North Bay, healthcare, going everywhere, that about a third of those were positive. That's a very high number, 1 out of 3. But right now we're essentially at about 7%. And so that's our positivity rate. And then what's most important to me and what most public health officers feel is the most important metric is hospitalizations, right? Because really, and we'll get into this about how to live with this virus, it's really about whether it overwhelms your healthcare resources. And that includes primary care clinics. I'm going to jump right back in, and I think we cut out in the middle of data, so I'm going to go over the data. It just takes a minute, and then we'll go right into your questions. So sorry for the technical difficulties. So our case rates in Solano County, 50 per day for the 7-day average. That's still a little higher than the lowest point before the Omicron infection hit us, and Omicron variant hit us in December, when we were really about 40 per day, and a little less than that. Our positivity rates are 7. That's still fairly high compared to where we were at the nadir, the lowest point in between spikes previously. Pretty much, it's almost double pre-Omicron. I said when we were talking previously that positivity rates are a little messy, right? It depends on how many people get tested. Also, that's a denominator. So, and we know as infections drop, people get tested less. But still, during the height of the Omicron variant, we were at like 30% positivity rate, which meant 1 in 3 were testing positive for those who tested. So 7 is definitely an improvement on that. And then hospitalizations are the most important metric we follow. Really, when we talk about how to control this virus, how are we going to manage it as it continues to cycle and change? And it's all about whether it overwhelms healthcare resources. In particular, do we make sure that we have our hospital-based resources set so that we can care for the most severely ill. And as of Monday, the last time Solano County updated their data, they updated Monday, Wednesday, Friday, we had 31 hospitalized in our county. That is low compared to the 100, 200 that we had during some of these waves of infection. But it's still a little higher than we were pre-Omicron when it was under 20. We are still seeing a drop in hospitalizations. We're seeing it here at North Bay. It's slowed down considerably, but it is there. And with that, we'll go right into your questions. What questions do we have?
Okay, so we've talked about how the numbers are low and masking rules are easing, but is it too early to say we've defeated COVID and we could stop worrying about it?
So the question is as rates continue to drop, will COVID go away? Or some might ask, is it become an endemic where we're just living with it and it's cycling like flu is and we can live our lives normally? I don't have an amazing answer for that one. There's a lot of different opinions. I think there's a couple kind of consensus opinions out there from the experts, and here's the ones I agree with. So there's not enough vaccinated people in many countries to not think that the COVID virus is not going to continue to mutate and cause new variants that cause problems. Those problems might lose severity, and maybe it really is not a big deal, but it's hard to predict. But there's no doubt that there'll be new variants that become headlines in the newspaper that go from being variants of interest to variants of concern, that just like the stealth one is right now. So the answer to your question is, it's not so much that we're going to defeat COVID. It's going to really be, can we just start living with it and normalize some of the things we do? And that's going to go back to my comment during the initial session about with the data. We have to make sure that our hospital and healthcare resources can manage those that become severely ill with it. And we have to have common sense policies around testing, isolation, quarantine, travel that allow people to live with the virus. That also means that we have to know what virus we have. What if the new variants actually cause really severe illness? That's a very different approach in regards to tolerating and transmission than, let's say, it causes kind of common cold symptoms. Does that make sense? Or as we learn more about what long COVID can do, then we can start living more with the virus. So it's important that the research continues. What does this virus do to our bodies? How long does it last for? And then I think we'll be able to live with it. So it's not going to be a defeat situation where it's gone. It's going to be a living with situation for the time being. But I also do believe, I'm optimistic that we're not going to have to go back down to a full lockdown again anytime soon. I think it'll be a little here, a little there to mitigate transmission to those that are highest risk for getting severely ill. That's what I think will happen, and that's assuming we don't get really nasty variant anytime soon, so there's luck involved in that a little bit. That's nature. And that we continue to find ways to vaccinate the world, which is hard to do, but we need to do that if we really want to see this get controlled. And so, and that we're organized, public health is organized, locally and in the state and nationally to have kind of a blueprint, to have good common sense standard ways that we all respect each other and follow transmission precautions, and then we can live with it. We can travel more. We don't have to be as anxious and concerned. So a lot of work around that, but I feel like we're in the right direction with some of the things that have come out in the last few weeks. So more to come on that. We're in a great period right now, but I do think we're getting better and better at managing each time. Omicron was several times higher in rates than any previous spike. So that's also something that, where we thought we had control over it because we had so much experience from the other spikes infection, Omicron challenged us even more. And so I think it's hard to know what's going to happen. If we never see a spike like that again, then I think we will be able to live with it. And so maybe there's a defeat there, that we've defeated it. But I think if it's hard to predict because we don't know what that next virus looks like.
Okay. So what's the theory on why we're seeing the numbers decline? Is it vaccine effectiveness, herd immunity, better preventive efforts?
Yeah, that's a good question. So the question is why do we see rates go up and rates go down like this? There's a lot of literature on this. Lots of literature on this. And I'm gonna summarize it fairly simply, I think, at least for myself. There's a lot of factors in why we see regular increases and decreases in infection, and why it's such a sharp increase and then a fairly symmetric, often, decrease in infections. There's a few factors. One is that maybe you don't think you do, but in general, people stay around the same groups. They just do, like whether it's families, friends, other community environments, schools, work, all those things. There's of course mixing, but there's still microenvironments. So once either people are vaccinated or infected, and that the virus saturates that group, or they're vaccinated, then new infections slow down. So that's factor number one. Number two is that people naturally, even subconsciously, get better and better at compliance with transmission measures. Maybe they wear a mask a little bit more. They're a little better about hand hygiene. They're a little more careful with distancing as infections go up. And of course, there's a delay there, but it carries us through. So those are the big reasons why we see an increase and then a decrease. And the last is often, not always, these new infection periods are associated with some sort of holiday or like a trigger where there's a lot of group settings, and then those people get infected, and then things improve. So that's why we see that. That's why we see that.
So you said that we're seeing a little bit of this new variant or subvariant.
Yeah, about 16%.
Is Omicron still the main variant that we're seeing?
Yep. So CDC has this. It's public data. There's actually a robust amount of sequencing going on in California and around the country. And the answer is Omicron BA.1. So the original Omicron is still the absolutely the predominant variant that we are diagnosing right now. And then there's still a little bit of Delta, and there's and again we see a growing, but not quickly compared to Omicron, but a growing percentage of sequences being this BA.2, this Omicron sublineage, also called the stealth variant.
All right, so we have someone asking, what's expected to happen when children go back to school next week unmasked and most unvaccinated?
Yeah, that is a good question. My school district, same question I have and others have. So the question is these kids go back, mask being taken off or not required, kids can wear it indoors. Vaccination rates amongst the kids are the lowest in Solano and in many communities. What's going to happen? We're going to see some new infections. I don't know if that's going to be a spike because they bring it home. I think, overall, we haven't seen a lot of outbreaks in school settings. And I'm not sure the data is really clear on why, because kids are definitely interacting. But the answer is it's hard to think that we won't see some increase in infection. Will it be significant? I think the answer is to get vaccinated, to be honest. That's the best way to protect yourself. If you're concerned about your kid, there's no requirement not to wear a mask. I'll tell you a story that, in my personal life, and I coach a softball team, and it's outside, and there's no requirement for masks because the outdoor rules, you can take them off. The kids are still wearing them, and I'm still wearing them. I'm wearing them both to set an example so that people feel comfortable wearing them if they want to, and also I think it's a little early right now, and everybody feels more comfortable. They're used to it. I'm saying that all to you because even though it's not going to be a mandate anymore, it doesn't mean kids can't wear masks, and others will be wearing a mask too. They're not going to be the only ones. So especially if your child is not vaccinated, I would highly recommend wearing a mask for now. And we're, things can just be for weeks. I think one good approach is let's leave masks on for now. Let a week or two go by. Kind of see what the change in policy does to the rates. Right? Things continue to drop. You need to have enough virus for it to spread amongst people, and that's where that whole herd immunity piece comes from. Right? So if in your school district, school, whatever classroom, there's enough kids either who have had Omicron or are vaccinated, it's probably not going to spread very easily there. So there's so many factors that are hard to measure. My point is I have the same concern you do. At least I think what I read in that question is, aren't we going to see some spread in schools? And I think we run the risk of that. And I think a conservative answer is leave your mask on your kid for the first few weeks and see what happens, and then that can come off. If your kid is vaccinated, you could be a little more less conservative. I think outside is fairly safe these days. I think there were a lot of experts who felt period that outside was okay, even during Omicron, which is so much more highly contagious. So that's really decision. I think it's hard for my kids to wear a mask all day, indoors and outdoors. So I do encourage them to take a break outdoors when they're, and just be a little careful how close you are with friends and sharing food and things like that and being too close. So I hope that helps a little bit. You'll get a lot of different opinions around this. I think taking masks off indoors right now, it's a little of a risk, but we also have to combine how much natural infection there is, how much vaccination there is, where the importance of just education and our kids seeing each other's mouths move. I know my kids talk about how hard it is to hear each other. That's really important. So I understand the reasoning why, and I'm very mixed about taking off masks for schools indoors. It's really hard, again, because I'm trying to balance safety and transmission with how important it is to have the maximum benefit of being in school, right? So, and how it's impacted our kids, their mental health. We have a lot of kids who are now behind, who weren't before COVID started. The education piece is so complicated. I do not envy our superintendents, our teachers, our leaders who have to make these decisions. I'm really thankful for them. So not a clear answer, but I hope that helps.
All right, so what treatment options do we have for patients? And are they available for everyone, or are there certain limitations on who can get, like the oral meds? And
Sure. So that question is about what treatments are available. There's new updates every week, but the basics have stayed the same. We have monoclonal antibody options, which is an injection, and a one-time injection most of the time. And by the way, there's a lot of different policies out there that are way too long for this talk, including prophylaxis ahead of it, and whether some monoclonal antibodies work for Omicron, some don't at all. And then we have two right now, effective oral medications. Nothing's a magic pill, like it works amazingly, by the way, but they all work. But some, they have side effects. Some are definitely not safe in pregnancy. There's a lot of factors, and they're generally restricted to those at high risk for severe disease. That's because there are side effects. The benefit is not amazing, so we see the greatest benefit in those who are at risk for severe disease. So I hope that helps. So the answer actually is, if you get Omicron, if you get COVID, and you are at high risk for severe disease, or you even think you're at high risk for severe disease, or you don't know if you're at high risk for severe disease, reach out to your primary care doctor and they will guide you. They're used to answering this all day long, and they'll help you, and they talk about options and whether you are a candidate for therapy. And again, there's actually enough therapy to go around. But it's like, does the benefit outweigh the risk? That's the whole piece around whether it's helpful for somebody who's healthy and younger and gets Omicron, or versus somebody who's older age, maybe is immunocompromised, being treated for cancer, has diabetes. There's a lot of factors. But it's too much for this talk to go through each detail, and you won't remember anyways. Reach out to your doctor if you think you may be a candidate and you get COVID. Reach out to them early. The oral therapies and the monoclonal antibody, although different timelines, are most effective earlier. So, and these are treatments for those who are not hospitalized. If you get admitted to the hospital, we have a whole another group of medications we use that are effective for hospitalization, for hospitalized patients, with one of the most effective being steroids. So, injection steroids. So, and oral to some degree. So if you're mildly ill, you don't need to get admitted to the hospital. That's the definition of mildly ill in this case. Reach out to your doctor. There may be some options for you if you're at risk for getting severe illness, and maybe not. So just reach out to your doctor.
Can you talk about the vaccination effectiveness, and any talk about, are we going to need another booster? I know the CDC came out with some information that after 5 months in 12 to 17-year-olds, the immunization, the effectiveness wanes.
Good question, Robin. So the question is, there's some data coming out that there's waning immunity after the vaccination, particularly in the teenagers, after 5-6 months. Are we going to keep needing boosters? Yes, I think there'll be a need pending, as long as the COVID virus stays around and causes severe illness or a risk for a long-term syndrome that needs vaccination, we will likely continue to need some sort of booster. I don't know what the amount of time will be for that, like the interval between the shots. I don't think it'll be every 6 months. I think it'll become longer, and I'll tell you why in a second. But yes, we'll likely need some sort of booster. When you read those studies about waning immunity, just remember that there's different types of immunity, right? So we often see antibodies drop, period. That's like normal. And then what comes after that and with that is cell immunity, which is most important for guarding against severe illness, which is what we care about the most. So my point is, when you see oh my God, the vaccine doesn't work after 5 or 6 months, that's not what those studies show for the most part. They're really more about the types of different immunity and how they change. We even saw with the primary series way back in before Omicron, the Delta days, a drop in antibodies, but still really good protection against severe disease against Delta, for instance, because the cell-mediated immunity remained strong. So just putting out there that when you see those headlines, either read the fine print carefully or remember that there's different types of immunity, and unless it says it, like cell immunity is gone too, and antibodies, and the vaccine's not helpful, just take it with a grain of salt. Does that make sense? And wait to see what the recommendations are from the CDC and other governing bodies, because they're unbiased. Those are independent organizations whose entire job is to keep us safe. So I follow those guidelines. You should too, and they're really compiling the data they're looking at and deciding on the intervals. One comment about boosters and how often we need them. Remember that the flu vaccine actually mutates faster than COVID. We've known that since the beginning. We can see the mutation rate of COVID versus the flu. We only need a flu once a year. It's fairly seasonal. I hope we'll get maybe it'll be even the window will be longer, hopefully, for COVID, if we need regular boosters. So just putting it out there that, every time there's a new flu variant, it doesn't get the headlines, right? So, because it doesn't cause a severe disease and doesn't transmit as much, and it just doesn't get the headlines. So I'm saying that all to you because every time we see a new variant, we think, oh my God, this virus just keeps mutating, and it's going to. But just remember that it's not. The flu is in the background mutating all the time, also at faster rate. And every year we create the vaccine based on the variants they're seeing in the southern hemisphere, and that's why they're never 100% protective. They're 70s sometimes, and that's really helpful. So just putting it out there that I think it will become endemic. We'll eventually need like regular boosters. I don't think we'll need it every 6 months. And maybe it'll be once a year, maybe longer than that. Maybe this virus will mutate to something that's really not severe at all, and maybe that will change our need for boosters. There's too many variables to know completely.
Okay, well, we are about out of time, but before we end this broadcast, we want to let people know that on March 31st at noon, you'll want to tune in again when we will have registered dietitian Laura O'Mary. She's going to do a cooking demonstration live and talk about healthy eating choices. So you won't want to miss that one. With cooking.
Wow. Have a wonderful day out there. Sorry again for the technical problems. I hope everybody got back in, and have a great day. Be safe out there. Thank you.
Thank you.